Hello dear listeners, welcome to our channel and to the new episode. Today, we will be discussing a very important and profound topic, bipolar disorder, also known as manic-depressive illness. This disorder causes significant mood swings in individuals. We have a very valuable expert with us today, who has been specializing in psychiatry and researching bipolar disorder for many years. Welcome, and thank you so much for joining us.
Thank you for having me, it's a pleasure. We'll be addressing an important topic today, and I hope it will be helpful for the listeners.
I'm sure it will be very helpful if the listeners watch the entire video. Bipolar disorder causes significant fluctuations in mood, moving between manic and depressive episodes. Can you explain a bit more about how this disorder works and the effects of these sudden mood changes on individuals?
Certainly. Bipolar disorder leads to extreme fluctuations in a person's mood. This disorder causes a person to experience sudden surges of energy in the manic phase, followed by deep depression. During the manic phase, individuals may experience excessive excitement, an increase in self-confidence, and may engage in risky behaviors. On the other hand, during the depressive phase, they may feel intense sadness, fatigue, and hopelessness. These mood swings can significantly disrupt daily life.
You mentioned that there are different types of bipolar disorder. Could you explain the differences between these types? Which types require more treatment?
Yes, bipolar disorder is divided into three main types. Bipolar I disorder. This is the most severe form, where a person experiences a major manic episode, often requiring hospitalization. Bipolar II disorder. In this type, manic episodes are milder and are referred to as hypomania. Depression episodes are more prominent. Cyclothymic disorder. This type involves milder, shorter mood swings. Individuals may not lose full functionality, but the symptoms still affect their quality of life.
Recognizing bipolar disorder is important because early diagnosis can really make a difference. Manic and depressive episodes have very different symptoms. Could you go into more detail about the manic phase? How do individuals feel, and what behaviors do they exhibit?
During the manic phase, individuals experience high energy, excitement, and an increase in self-confidence. They may speak rapidly, and their thoughts can feel disjointed. Risky behaviors, such as making large purchases, engaging in dangerous activities, or having difficulty sleeping, can also be observed. During this phase, people may push boundaries and do things they would normally avoid.
What about the depressive phase? Individuals may feel more intensely isolated, drained of energy, and experience other symptoms. How does this affect their interactions with others and social life?
During the depressive phase, individuals experience intense sadness, hopelessness, and fatigue. They lose interest in activities they once enjoyed, which can cause them to withdraw socially and struggle with daily tasks. They may feel worthless, and these feelings can even lead to thoughts of suicide.
How is bipolar disorder diagnosed correctly? What steps are taken in the treatment process? Can you give our listeners information about the treatment process and the methods used?
Bipolar disorder is diagnosed by psychiatrists through a comprehensive evaluation and various psychological tests. The treatment process typically involves medication, psychotherapy, and lifestyle changes. Medications such as mood stabilizers and antipsychotics are commonly used. Additionally, psychotherapy can be highly effective, helping individuals manage symptoms and develop coping skills. Exercise, a healthy diet, and social support also play key roles in the treatment process.
Early diagnosis and intervention are really important. Is bipolar disorder more commonly seen in younger individuals, or can it develop at any age?
Bipolar disorder typically manifests during adolescence or young adulthood, but it can develop at any age. Early diagnosis and the beginning of treatment can significantly improve a patient's quality of life and reduce the severity of symptoms.
Today, very valuable information has been shared. Talking about bipolar disorder will raise awareness and encourage people to take steps toward treatment. What advice would you give to the listeners on this topic?
Bipolar disorder can be a challenging condition, but it can be managed with the right treatment and support. No matter how overwhelming the symptoms may be, help is always available. Early diagnosis and treatment can greatly improve the quality of life for those living with this disorder.
Thank you so much for sharing this important topic with us today. Dear listeners, I hope you've gained more insight into bipolar disorder. See you in the next episode. Take care of yourselves.